We have a straight 3 versus 3 divide on this very important subject. Dr. Prabodh Ganguly, CEO of Vision Intellectual Property Rights from Mumbai. Kewal Handa, Chairman of Medibiz and former Managing Director of Pfizer, with me in the studio. Thank you very much for coming. Dr. B.S. Ajay Kumar is Chairman and CEO of the HCG Group of Companies. He says it's a short-term benefit for India. I support patents only for the short term. Dr. Samir Kaul says government should have stepped in earlier because prices should be negotiated. Playing a very critical role, counsel and lawyer for Cipla, Pratibha Singh, and senior advocate and director of the Lawyers Collective, also a lawyer for the Cancer Patients Aid Association, Anand Grover. Sir, my first question is to you, Mr. Grover. You are very clear. You are saying companies like Novartis are only interested in profits at the expense of Indian patients. Can you elaborate your position, please?
First of all, if you look at the present case, Novartis did not invent this drug. This drug was invented through public-funded projects by a person called Brian Drucker in the United States. This is an orphan drug. They got tax breaks. They did not even put $400 million for the whole of the marketing. But they reaped $1 billion in the first year. This is not an invention. There's no innovation in it. And the Supreme Court has rightly said that this is a drug which is hit by 3D. It's just a new form of an old drug. It doesn't deserve any patent. Most of the companies in the US and Europe, North America and Japan, 76% of the drugs are those drugs which are new forms. These are the ones that are being patented. Therefore, in India, we brought in 3D, which says the new forms of known substances should not be patented. And this is the case of that type. The Supreme Court rightly rejected the claim of the Novartis company on
the other side,
which is Gleevec, which is the drug. On
the other side, you have two gentlemen, with contrary positions. I'm going to come to Dr. Prabodh Ganguly, who actually supports these patents. He says that because of today's judgment, innovation may not take place and Indian patients will be, worse off because of this. Kewal Handa does not agree with this profit-making motive thing. Tell me, Mr. Handa, here's a situation. This drug called Gleevec, in India, it is available. A patient can spend some 7,000 or 8,000 rupees a month and use this drug, kidney cancer patient. Tomorrow, what answer will you give to a kidney cancer patient who will overnight, had the judgment been different, have had to sell over a lakh of rupees? Where would the money come from?
At the outset, this particular drug, yes, Novartis has given $1.7 billion of the drug free to the patients in this country. 95% of the patients get this drug free. I think, and the balance 5%.
What's the guarantee they'll keep getting the drug?
They are getting it for so long. And I think this data point that this drug is 1 billion in India is not true. So I think we need to get our data and facts.
No, you answer my question here. My question is that suppose
I'm sorry, this is not correct.
You want to contest? Okay, go ahead. Anand Grover, please contest. I'm coming to Pratibha Singh also, please.
No, because this data was contested by us in the Intellectual Property Appellate Board. Novartis did not rebut what we said. They have no answer. And this is data from Novartis itself. And the so-called program, which is called GPAP, it's a fraud. They know it very well. That was also contested by us. They did not rebut it. So please do not raise issues which have not been rebutted by Novartis in the court. Don't use this television medium to push their agenda.
No, I am not pushing anybody's agenda. This is a public knowledge. They have made statements.
You are.
They have made statements.
Because you are not, you didn't have the chance, you had a chance to rebut it, you did not do it. And don't spread those false notions across television.
I don't agree with you. 16,000 patients are already on this data, on this drug. And if you look at the value of this drug in the market,
they are there only because you want to push that agenda.
No, I don't agree with you on that point.
I want to say.
But the broader issue
we have patients who are getting free drugs also.
The broader issue still remains. The broader issue still remains. That 3D is not been neutralized by the court.
No, the broader issue is very simple actually. Yeah. Samir Kaul wants to come into the debate. The broader issue is this, that today there is a person who is having end stage or second stage or third stage or first stage, whatever, kidney cancer. And he needs this drug. Now, had the Supreme Court verdict been different today, he would have to find a way to get 1.5 lakh rupees a month to survive. I want to know the argument against.
Arnav, why are you penalizing a pharmaceutical company for lack of healthcare safety net?
I am sorry, but the reality in India is that no government of India will pay a patient 1.5 lakh rupees.
No, there
to
could
get
be
that drug.
There could be a different vehicle to get this.
Samir Kaul wants to come in. Samir Kaul, who's hyping this here? Me or the gentleman sitting next to me? Yeah.
I think, gentlemen, good evening. As somebody who actually real-time uses these drugs on patients, we're not talking about kidney cancer today. That may be a similar issue, but we're talking about Glivec, which is used for chronic myeloid leukemia. A cancer, the patients of which young patients actually live after they get this drug. So, in a background of patients who have got more access to this saving of their lives today, I have to make a couple of points very clear. That I'm happy on 3 counts. I'm happy on the fact that this judgment today, which I'm sure that our preeminent jurists will decide whether this 3D was applicable and they actually had an innovative increment or didn't have. But what I can tell you today is that this was an epoch-making decision today, because today this country is talking about patient rights. It has actually achieved so much of public attention that we are debating it on national television tonight. I am happy for that. I am happy for the fact that many more patients below the poverty line will get access to this drug. I'm also happy for the product that today, if ever, that our own pharmaceutical companies will realize that they need to do more in the research and development.
Oh, absolutely.
But on the other hand, gentlemen, can I just last, can I leave you with a word of caution? That rather than painting this whole thing as an East India company having come back and robbing our country, there are many products which are way away from our own research and development capabilities. And I'm talking about Herceptin, Trastuzumab, autoimmunoconjugates, Baxter, and a whole lot of them for which there will not be a foreseeable R&D in this country.
Sure, there isn't, but I'm talking about tonight. I'm talking about tonight. My question is, yes.
Hello?
Yes, I'm coming to you, Dr. Ajay Kumar. Please tell me, you are saying, if Novartis is such a great company, if it wants to help the poor people of India, then why would it stop poor kidney patients in India, kidney cancer patients, from getting a drug at 1/10 the price? Why would it do so?
I want to intervene.
I'm coming to you, Pratibha Singh, just after Dr. Ajay Kumar completes. Dr. Ajay Kumar, please, in Bangalore. Samir Kaul, you had your say. I'm going to Dr. Ajay Kumar. I'm going to come back to you after that.
I want to say...
No. I just
as an oncologist...
It's not about
as an oncologist...
Kidney cancer is Pfizer. We're talking about...
Yeah, it is about chronic myeloid leukemia.
Come on, sir.
Hello.
Yes, go on.
Let me say a few things. It is a drug approved by the Drug Controller of India for chronic leukemia and a condition called just tumor. These are the only 2 conditions for which it has been approved. I'm a practicing oncologist, practiced abroad and here. All I want to say is, while I am all for generic drugs, affordability is a factor. What I want to say is, for a short term, it's definitely beneficial. But having said that, somebody like Novartis, with whom we work very closely for patients, for all below poverty line people, they give free drugs. For all people who are middle class, there is a scheme under which they benefit. The cost to them on an average per year is 2 lakhs.
I'm sorry.
But
today,
2 to 3 lakhs.
Today, the Novartis president said.
I want to say something.
No, sir. I'm questioning the altruism of the company. 1 minute, sir. 1 minute, sir. Today, sir, don't. Sir, 1 second. Dr. Ajay Kumar. Here is a company which told us today, no other global company will invest in India for research, given the current atmosphere. We are being told you will not have medicine for your children.
No, I want to ask you one thing.
1 minute.
Why are we Why are we as Indians are not innovators? Why can't we produce?
That's another
drugs?
issue.
Why don't we go to biosimilar and be
Don't
copycat?
sidestep the
Why
issue.
can't we really make the drugs ourselves?
Sir, I'm asking, don't sidestep the
Why
issue,
is it
sir.
not correct?
Pratibha
I am in
Singh.
oncology. I know for
Sir,
a fact
sir,
that
I
think we are
India has
missing the
never been
point in
innovator.
Sir, the question about Indians being innovators will be discussed later. Today I'm asking you, how can an Indian be denied? How can any foreign company come into our country and tell us
No, we are
whether or not
denying.
the poor
See,
people
what
of
I
India
want to
will
say
have
is
drugs?
we
Sir,
are the
please.
largest cancer care providers in the country.
So
and we treat 45,000 new patients. The incidence of chronic myeloid leukemia is 1.5 per 100,000 population. There are 60,000 active patients with chronic myeloid leukemia.
Yes,
Majority have been supported. Those who deserve have been supported.
So who decides?
I treat
I
patients who
don't
have been
totally
supported.
disagree with
What
this
I want
data,
to say is,
which they are
for a
now trying to
short-term
put
goal,
out.
Who decides?
we should not forget the
Sir, who
long-term
decides?
goal of
Sir,
looting
I'm sorry.
innovation.
Who decides whether or
No,
not?
there is a system where we decide. We have medico-social workers,
Sir,
below
the-
poverty line
sir, the
people,
question-
those who cannot afford.
Sir, the-
those
This
is
who
all
come in
propaganda by Novartis.
BMWs,
One minute.
Skoda cars, they cannot be given
I'm
free
getting to
treatment.
Pratibha Singh next. Pratibha Singh, I actually, please, Dr. Ajay Kumar, please understand one thing. I am not, the debate about whether we should be innovative or not will come to. Innovations don't happen overnight. Innovations take years and a lot of money in development. I am
The only
asking
thing
you.
is deserving people should get free care.
Yeah, sure,
Not
then.
everybody. Those who can afford to pay, why should they get free care?
So that is not for a foreign company to decide tomorrow. Pratibha Singh, why don't you respond, please, to the points made
No,
by
not
Dr.
for the
B.S.
BMS
Ajay Kumar.
system where
So what?
they're evaluating.
See, there
Pratibha
are,
Singh,
there are
Counsel for
five.
Cipla, the Indian company, please, is responding to you, sir.
Yes, yes. There are 3 or 4 more important points that I need to highlight. Firstly, imatinib was a pre-1995 drug and was not entitled to patent in India. What Novartis tried to do in this Gleevec patent is, in 1998, to apply for a patent by saying that this is a beta form of imatinib mesylate, which was a pre-1995 drug. The Supreme Court has rightly held that imatinib was known, imatinib mesylate was known. The mere fact that beta form is more soluble, more stable, or more hygroscopic doesn't entitle it for a patent. And that's a very, very simple analysis which the Supreme Court has done. And there is no one to answer as to why, when in 1993, Zimmerman got a patent for imatinib and India did not have product patents, why was this backdoor being used to register a patent and to exclude all generic companies from making a drug which was covered by the 93 patent and not by the 98 patent?
See,
This is something that we cannot answer, and the Supreme Court has rightly held that this was a 1993 patent. There was nothing new in 1998,
Yes.
hence Gleevec is not entitled
Yeah,
to it.
and besides the
we
point
should
is...
first deal with this issue as a technical issue.
No, besides, I think the point here is, Dr. Ganguly, sorry to come to you last, the question is, as even Justice Iyengar observed today, the provisions of a patent law have to be designed with specific reference to the economic conditions of the country, its future needs and other relevant factors. It cannot only be from the point of view of the drug pharmaceutical company. It has to be from the point of view of the patient and the economic circumstances in the country, of the country. It can't be oblivious to them, Dr. Ganguly.
Adnan, I just want to add one thing before Dr. Ganguly.
Yes, Dr. Ganguly, please continue.
Hello, can I?
Yeah, please continue.
Yeah. What I want to say is that first of all, I would like to say that people are getting completely submerged in emotive matters and not in substantive matters. So therefore, we must keep the emotive matters a bit away if we want some logic to come on the forefront. So therefore, I would first like to submerge the emotive matters away and come to substantive matters on this.
Now, what is the emotive matter? Please explain. What in your view is it? No, what in your view, please tell me, Dr. Ganguly, what is the emotive matter which is of no relevance to the debate? Whether cancer patients live or die as a result of this judgment?
No, I did not say it's of... No. I did not say it's of no relevance. I said you must look at emotive matters separately. For example, the issue of prices and whatnot have to be looked into in the context. Now, first of all, that people have to invest heavily to come in with innovations. Innovations don't come from nowhere. So that's the first part. Second is that any patent law is a quid pro quo. And in that, what happens is that whatever innovations you have done